Well, a warm welcome to today's talk. It's Friday the 3rd of September. So a bit of an orientation update today on what is now the Delta variant pandemic. Now let's start with a few orientation slides because we've been looking at research for the past few days, and of course the pattern in the world changes pretty quickly, of course. So here we have daily new confirmed COVID-19 cases per million. New Zealand levelling off. Now Australia is going up, particularly in New South Wales and Victoria. So Australia is not going to go back to zero now. I think we can say that with a fair degree of confidence and certainly a high degree of sadness. It looked hopeful for a long time, but Australia is going to have ongoing cases, I am afraid, now. South Africa looking fairly good from that data. Ireland looking promising as well. I believe this is fairly accurate data from Ireland, and I mean the fall is not quite as dramatic as this would appear, I don't think, but there does seem to be a downward trend, which is good as their vaccination rates have been increasing now for some weeks. And then, of course, the United Kingdom, well, we're actually still, well, according to that, we're level, but we're probably actually still going up. Likewise in the United States. So the United States actually overtaken the United Kingdom now in number of cases. Hospital patients, which of course are perhaps the most relevant. Now, later on I'm going to show you that the hospitalisation in the United States is very unequal. Very unequal. A lot of southern states have proportionately much higher numbers of hospitalised patients, but this gives us an overview. Canada, Ireland, United Kingdom, United States, and basically it's an upward trend in all of those countries. Not most countries, the overall figures aren't as high as they were last winter, but still nevertheless an increasing trend. New data confirmed deaths. South Africa, the deaths do appear to be quite high. United States increasing. United Kingdom, Ireland, Canada, Australia, New Zealand in terms of deaths. Population fully vaccinated. Well, as we've expressed concern about quite a few times, if the virus gets out in Australia and New Zealand, there's a lot of vulnerable people still. So I am pretty concerned at the moment about New South Wales. I think Australia's fairly well compartmentalised and the protection is increasing in New South Wales, but it's not enough. So the potential for ongoing spread and severe illness in New South Wales is certainly there, as the Australian vaccination figures aren't as good as we'd like. The United States not climbing as high as we would like either. United Kingdom, Canada, Ireland both Canada and Ireland both doing well. So that's people fully vaccinated, share of the whole population fully vaccinated. And just to show this is the R line here really. That's 1. So we can see that cases are just dropping in Ireland. They are dropping in South Africa, but cases are going up in the United Kingdom, the United States, Canada, Australia, and New Zealand. This high proportionate swing apparently in New Zealand, it's apparent swing because it's based on a low number of cases. But we see those ongoing, concerning really, R values in many places. Now, what should we do next? Let's look at the COVID bounce back in the UK. Now, I think this is based largely on COVID symptom tracker data, which I'm going to show you now. So current prevalence, 740,000 in the UK. You can look up your own area there. Obviously, I include the reference. New daily cases, 57,000 symptomatic cases. And we are seeing a definite resurgence here over the past few weeks up until the data they're taking us up till yesterday, the 2nd of September. So I'm afraid there's a definite increase there, and that's what I want to talk about now. So this is sort of the COVID bounce back really, in terms of number of cases at least. Now, this is based on PCR and lateral flow tests, so it's taking positives from both of those. Now, to be fair, I agree with this, because the lateral flow tests, if anything, are likely to give a false negative. They're likely to miss the virus if it's actually there. If they're testing positive, then that's basically pretty accurate, probably about 99% accurate. Now, of course, this data is based on the 7th to 21st of August, so it's a bit out of date, but this that screen there is bang up to date straight from the website. So we can see that this trend is still increasing and this still applies. Based on about 1 million weekly contributions, excellent, and nearly 26,000 test results. So the good numbers from which to derive this data. Symptomatic cases in fully vaccinated people in the UK, 29.4% of the total. Now, this is not good, but this is largely due to... let me just show you this graphic. This is the cases, largely due to the cases, not the people getting sick. So let's look at some real data here from the COVID symptom tracker study. So total number of new cases in total, number of new cases in fully vaccinated people. So this is the total number of new cases. But we definitely see an increase in the number of people that are vaccinated. Partly due to the general increase in the country, we can see that these are mirroring each other, but we are seeing a lot of breakthrough symptomatic infections. And as we say, this data is showing 29.4% of the total new daily cases in fully vaccinated people. Thankfully, most of those cases are mild, but quite a striking graph indicating the waning of protection against infection. Incidence by age group, well, the highest age group at the moment we see here is the 18 to 35s, followed by the 0 to 18s, followed by the 35s to 55s, then the 55s to 75s, quite a lot lower, and the over 75s. They've got to 120 there. I don't think there is actually anyone 120 in the UK, but that shows us the incidence. So highest in the 18 to 35s, but after that following this kind of age distribution. And this shows the accuracy of the COVID data. So that's the Zoe incidence in terms of people reporting symptoms. And these are confirmed cases. So we see it is basically pretty accurate data, which is good. Now, we won't look at this in a minute. I'll just show you this in. I've got the graphic up now, though. But this is the predicted long COVID incidence. Now, what this is showing is that in the second wave, which started on the 1st of September 2020, that was largely driven by the Alpha variant, we're getting more cases of long COVID in terms of number of new daily long COVID cases being reported. In the second wave, the prevalence of, or the proportion of long COVID is less. So we see higher numbers of long COVID caused by the first wave than caused by the second wave. And of course, we believe the reason for this is that there's many more people vaccinated now in the second wave. So that's providing a high degree of protection, we believe, against providing a high degree of protection against long COVID. More on that. We're going to look at some research on that, probably not in this video, but shortly. Now, getting back to this after those useful graphics, so 29.4%. Now, this is Tim Spector, direct quotes, the Professor Spector leading the study, of course. Our data shows post-vaccination infections are much more like a cold than flu, with the top symptoms being, now this is important, this is really important data, runny nose is the most common feature, headache is the second most common feature, sneezing is the third most common feature, sore throat is the fourth most common feature, and loss of smell is the fifth most common feature. So these post-vaccination infections are qualitatively different to the infections in the unvaccinated. And again, for reasons that can't really be explained now, reasons becoming bizarre, the government hasn't updated its guidelines yet. So Tim Spector's team, we again call on the government to add these cold-like symptoms to their list to help educate the public and catch more cases. Why the heck this is not done is one of the mysteries of science and sociology. Bit like the Loch Ness Monster, it's an ongoing mystery. What is going on here? Well, there is no Loch Ness Monster and there are no changes to the government website, so it's rather bizarre. So questions we've been calling on the government to answer for ages. Why don't they update their website in terms of symptomatic people after infection, as we say, runny nose, headache, sneezing, sore throat, loss of smell? Why don't they make some kind of declaration on the aspiration situation, that they're not aspirating before vaccines? Why don't they make some declaration on the potential efficacy of antiviral preparations such as ivermectin, as we've talked about? We're not saying one way or the other, but these things should be officially spoken about by the government, and they're simply not. It's simply not being commented on. And it really is surprising. Someone needs to get their act together on this. I mean, this is clear, unambiguous, and now, frankly, quite ridiculous. But moving on with this, as we've said, the UK during this time period, new cases higher in the 18 to 35-year-old bracket, followed by the 0 to 18s. Right, prevalence. Now, this time period, again, we're talking about the 7th to the 21st of August. So if anything, the prevalence is higher now. But on average, 1 in 100 people in the UK currently have symptomatic COVID. So that's probably about 1 in 95 now, because as we've seen, the cases have gone up with this little bounce back here, this uptick that we're seeing. And that's taking us up to, that was the 2nd of September, that's taking us up to. So pretty up to date. First, yeah, it is the 2nd of September, so up-to-date data there. Probability of long COVID is much lower than the previous wave, as we've seen, which is, where am I? Probability of long COVID, I'm too far down, there we go. Probability of long COVID is much lower than the previous waves, presumably due to the effect of protection from the vaccination. No particular reason really why the Delta variant should cause less long COVID than the Alpha variant. I don't think that is postulated by anyone really. Long COVID, estimated that 870 cases a day will go on to experience symptoms for longer than 12 weeks at the moment. Probability of contracting long COVID is much higher in younger people, but this is driven by the fact that more young people have it. That's probably as simple as that. It's not that young people are more prone to it. But no question that long COVID is an ongoing issue and will be an ongoing issue into the future, unfortunately. Even with vaccination, it's reduced it, not eradicated it. And what I forgot to mention is the R value at the moment in the UK is 1.1. Scotland is 1.2. So case-wise, it is increasing. And hospitalisations are somewhat as well, as we've seen. Now, Tim Spector's made a few useful comments on this data. So unfortunately, we're back in a position where cases, hospitalisations and deaths are all going up in the UK. The UK has the highest rate of COVID in Europe, despite our superior vaccination rates. Well, we've seen that Europe is largely catching up now. Certainly if Ireland's anything to go by, they've more than caught up and exceeded us. But I take his point. We have a high vaccination rate, but we have a high number of cases. So what is the difference between the lower cases in many places in Europe and the higher cases in the UK? The main difference between the UK and Europe is our lack of restrictions, Tim Spector believes, and I agree with him completely. In many parts of Europe, people are still wearing face coverings and observing some social distancing. In the UK, where we eagerly declared freedom, groan, from COVID-19 and did away with even the most basic social measures, COVID has found an opportunity to spread. Exactly as we predicted, of course, and as Tim Spector predicted. As kids head back to the classroom, there's a good chance cases will continue to rise from here. And we know that they are already. Cases are escalating already dramatically in Scotland, because the schools in Scotland go back before the schools in England. And we've seen this in the United States as well. So let's just look at a bit more data now from the UK. The UK summary here. These are the vaccination rates, which of course are good. But I'm afraid people testing positive, okay, it's up 1%, but deaths up a little bit, hospitalisations up 5%. This is a more significant increase. This is probably the more concerning figure here at the moment. If we look at cases in the UK, Well, as we saw in the other graphic, they are basically increasing. Some hope that they're levelling off there, but minimal. Healthcare provision in the UK, hospitalisations are going up in terms of daily admissions. Probably more importantly, the number of people in hospital is actually increasing, albeit relatively slowly. But that graph there is patients. Oh, that's mechanical ventilation there actually. Patients actually in hospital here, we see they are still going up. 7,500 patients currently hospitalised in the UK. Vaccination rates. That's for the first dose, I think, is it? Patients who have a second dose of the vaccine by report date. So vaccination programme still going on, but not as quickly as we would like. Now, moving on to the United States, just try cumulative cases in the States here. Well, there we go. That's cumulative cases in the States going up more steeply. Let's look at daily cases in the States, and again, as we would expect, it's going up. Not as high as the previous wave, it has to be said. Looking at deaths in the States, that's cumulative figure. Let's go for the daily deaths in the States. Go onto these sites. They are quite addictive, the amount of information you can get from them. So, well, levelling off there, but relatively high level. 1,328 deaths, moving average, 7-day rolling average, over 1,000 deaths a day in the States. Now, other data I want to show you that's highly illustrative from the States, that's trends in the number of COVID-19 cases and deaths in the US reported by the CDC. Okay, so we've looked at that. We've got that one on twice for some reason. Here we are. This is the one I wanted to show you. Trends in the number of COVID-19 vaccinations in the US. Well, it is going up, but as we've seen, the overall vaccination rate in the States is still quite a lot lower than in the UK and quite a lot lower than in Europe. So that is a cause for concern. If we look at particular states of interest, Georgia, for example, well, we see that the vaccination rate did go up, but it's kind of levelled off again, and that's the case in quite a few states. The original sort of shock of this increasing cases from the Delta variant seems to be levelling off, shall we say. But people are still getting vaccinated at a reasonably good rate. So the totals are increasing, but just very slowly. So that is vaccinations. Now, hospitalisations in the States. Let's look at that. This is the overall hospitalisations in the States here, going up quite steeply. Nearly as high as in the winter wave. But this belies the position. Now, this website's recently been upgraded to give us particular areas. So if we're going to Florida there, for example, well, wow. I mean, the cases of hospitalisations in Florida are now much higher than they were. Hopeful signs of cases going down there, but this is where the data's still coming in. So I think it's fair to say that hospitalisations are probably level at a highish rate, well, a very high rate, putting extreme pressure on the health services in some areas. Maybe have a look at another example here. So much data from the US. Let's look at Louisiana. That was a relatively low vaccinated state. And again, well, there you go. We see that the number of people in Louisiana now is much higher than it was in the previous wave, or Mississippi perhaps. We would expect probably a fairly similar position. Real stress on hospital systems in these states. Missouri might be similar as well. Yeah, well, higher than we would like. Maybe C, D, E, F. Georgia, let's try Georgia. Again, pretty well where it was. So we're seeing that cases in some of the states where vaccination rates were relatively low are higher than they were in the previous wave, putting real strain on the systems there. So I'm afraid the Delta variant surges on. Cases increasing in Scotland as schools go back. Schools starting to go back in England now, so we can expect a similar increase in cases in England. That will transpose through into some hospitalisations and deaths. We believe it's at a manageable level, but of course, as I was talking about yesterday on that interview yesterday, the waiting lists are just horrendous now in the UK. COVID has kind of pushed everything out the way, and a lot of people are going to be dying from conditions that they shouldn't have died from because of postponement of so much elective care. So this pandemic is actually wreaking havoc in different ways. The cases and the sort of what we can call the collateral damage. So a bit of orientation there. I hope that's useful. Varied, better and not so good news. And today, well, let me just show you out the window today. I mean, basically, we are not, the leaves aren't falling from the trees yet, but it is starting to feel reasonably cool actually here now. It feels autumnal in the air. Autumn is coming. We're on the 3rd of September, and we're going to completely lose the protection of summer. People will be congregating more indoors. There'll be more close contact spread indoors. Mask wearing is nothing like where it should be in the UK, unfortunately. And in parts of the States, it's not where it should be. Vitamin D levels of production will go down as people aren't exposed to the sun. I'm going to start taking my vitamin D supplements again, probably in the next week or two, unless I get some sun pretty soon. So, yeah, that's where we are, and we have this autumn to go. Now, things are going to get dramatically better in 2022, I believe, because the disease will be in an endemic stage then. But bear in mind, if you're watching this video, my understanding is that you are going to get this infection. Just get yourself protected. And as we saw yesterday, in fact, I might just show you that again. It really is worth reinforcing. People that are vaccinated have much lower incidence of the pathologies. So this is a list of the pathologies that people worry about as a result of vaccine side effects. Thrombocytopenia, venous thromboembolism, arterial thromboembolism. It doesn't include the myocarditis. That's myocardial infarction, which is a different thing, because we know that's a problem after some of the mRNA viruses. But that's your likelihood of getting thrombocytopenia after the Pfizer vaccine in the UK. That's the likelihood after the AstraZeneca vaccine. That's the likelihood. So you're like 3 times more likely to get it than a healthy person. So that one line there is what a healthy population would expect. 2.5 times more thrombocytopenia, 8 times more venous thromboembolism if people have the infection. 2.5, 3 times more arterial thrombosis if people have the infection. And these are the incidents for the vaccine. So in all cases, we can see that. So that's a ischemic stroke after the Oxford vaccine, a ischemic stroke after the Pfizer vaccine in the UK, and people who actually get the infection way more likely to get that complication. So given that everyone's going to get it, you can either choose to be one of these dots, or you can choose to be this dot. If these predictions are correct that everyone's going to get it, and I believe they are. So much safer to be in this part of the screen, round about 1, than this part of the screen, with 8 times the risk if you actually get the infection. So that just puts these side effects from the vaccinations are serious, but you're so much more likely to get serious complications from the disease. And it looks inevitable that everyone's going to get the disease, vaccinated or not, or get exposed to the infection at least. And they are the odds. We are free, at least in the United States and the UK, we're free to choose whether we want to be here with 8 times the risk or here with around about equitable risk. Your choice. So there we go. That's an update of where we are. Thank you very much for watching.